Hi, I'm Steve Adubato. Complex issue, Roe versus Wade. Two different perspectives on it on this show. First up, Kaitlyn Wojtowicz, and she's Vice President of Public Affairs at Planned Parenthood Action Fund in New Jersey. Good to see you, Kaitlyn.
Good to see you, Steve. Thanks so much for having me.
Is abortion legal in New Jersey in spite of the Supreme Court decision on Roe versus Wade?
Yes, abortion is legal and available in New Jersey thanks to a bill that was passed by the legislature and signed by Governor Murphy back in January of this year.
Got it. Kaitlyn, there are many who question, who argue that even those who call themselves pro-choice, who also argue for reasonable limitations, question, should a woman or anyone, a girl, age irrelevant here in this question? Well, it's not irrelevant. I want to ask it this way. Should an abortion be legal in every state of the union at any stage of a pregnancy, including into the 8th, going to the 9th month?
So I think what's really important when we talk about abortion being safe, legal, and accessible throughout the country and here in New Jersey is that every pregnancy is different and every person's circumstances are different. And so what we try to highlight is that when a person is making the decision to have an abortion, that it should be between them and their medical professional, determining what is best for themselves, their health, their families, and their life. And that what we really want is that government or politicians are not making the decision that really should be left up to the person who is pregnant and to their medical professional or their doctor to make.
With no limits. Kaitlyn, with no limits, meaning 8th, 9th month, just the decision of the woman who is pregnant and her physician. That's it. Government has no role in that late in the term of the pregnancy?
What I would say is that there are regulations that govern abortion just like other procedures. And when we talk about abortion later in pregnancy, what often comes up or what is often said in the media by those who are anti-choice is simply not how abortion care or medical care actually works. When someone is making the decision later in pregnancy to have an abortion, it is often a really hard decision. It is a wanted pregnancy, and their health, the health of the fetus, their life is at stake, and they are making a really hard decision. It is not someone who wakes up and just says that they are deciding to have an abortion that day. So we want to bring back the patient and the compassion into the conversation.
But the circumstances do matter. The medical issues, understood. If there is no medical issue, the woman just decides that's what she wants to do. And in New Jersey, I want to understand something. The law in New Jersey, as it relates to late-term pregnancy, is different in Ohio, where there was a 10-year-old girl who was raped by a 29-year-old man, and she had to go to Indiana for an abortion because she was pregnant for 6 weeks and 3 days. That is different than the New Jersey law, as codified as it may be under Governor Murphy and the legislature. What exactly is the law in New Jersey?
So in New Jersey, someone has the right, based on the Freedom of Reproductive Choice Act, to have an abortion, and that is the law in New Jersey.
At any stage?
In consultation with their medical professional and medical ethics and guidelines, someone is able to make that decision. But I will also just really want to highlight is that when someone is choosing or has to make the difficult decision to have an abortion later in pregnancy, it's because of a fetal abnormality, because there is a medical or health issue. It is not something where someone is suddenly making this decision lightly. It is often because of a really gut-wrenching decision that they have to make. And I really just want to highlight that this is not something that is made lightly.
I understand. But also, Kaitlyn, Governor Murphy is attempting to expand New Jersey's laws around the right to have an abortion. And there are many, including Democrats, leaders in the Democratic Party in the legislature, are saying no. What is he looking to do, and what do you believe that opposition's about?
That's a great question, and I would love to talk about that because
You got a minute? Go ahead, about a minute. Go ahead.
so what we would love to see happen in New Jersey is not just that abortion is legal, but it is accessible because for too many New Jerseyans and too many people across this country, while abortion might still be legal despite the US Supreme Court's decision, it is financially inaccessible. So what we would like to see happen is mandating insurance coverage without cost sharing or copays, ensuring that everyone, regardless of their insurance status, their immigration status, their family status, is able to access the care that they need and deserve because abortion is healthcare and healthcare is a human right.
But I want to be clear, for someone who does not have legal status as a citizen, the government should pay for that abortion?
We believe that anyone who is here in the state of New Jersey should be able to access healthcare. And so we believe that everyone should be able to make the decision for their healthcare that is right for them and their families and their lives.
But the governor's initiative has not been voted on, and there is opposition, just to be clear, significant within the Democratic caucus in both houses.
So there is a bill currently, the Reproductive Equity Act, which is S 2918 A 4350, which would, like I just said, mandate insurance coverage without cost sharing or copays, ensure that there's coverage for folks who are lacking a pathway to insurance, or there is uncompensated care funds for them, as well as several other protections. And we at Planned Parenthood Action Fund of New Jersey fully support this bill.
Kaitlyn, I want to thank you for joining us. We appreciate it.
Thank you so much, Steve.
Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Atlantic Health System, Rutgers University, Newark, Community Food Bank of New Jersey, MD Advantage Insurance Company, Summit Health, the New Jersey Economic Development Authority, Horizon Blue Cross Blue Shield of New Jersey, Robert Wood Johnson Foundation, and by Wells Fargo. Promotional support provided by NJ.com and by Insider NJ.
The Community Food Bank of New Jersey, the state's largest anti-hunger, anti-poverty nonprofit, together with our 800-plus partners, delivers food, help, and hope to the hundreds of thousands of neighbors in need who are struggling with hunger right now. The Community Food Bank of New Jersey. Food is here. Help is here. Hope is here. Join us. Go to cfbnj.org now.